When I was pregnant, I was obsessed with habaneros. You could not make food spicy enough for me, and I paid for it in a very painful way. Now I have cut back seriously, and that heartburn is completely done away with. So one of the things that moms should do is avoid spicy foods. Make sure you are avoiding hot pepper. Hello, moms and dads, and welcome back to Nurse Onyi Teaches. My name is Onyi, and it is a pleasure to have you. If this is your first time here, make sure you grab a pen and paper and look around at some of the other content that I've been covering, because I believe that they may be of value to you. Also, if you want to learn more about your maternity journey, postpartum, how to care for babies, make sure you hit the subscribe button and then turn on your notification bell so that you are made aware of every time a new video is uploaded. Now, before I jump into today's video, I'm going to put this little disclaimer here. Do not use this information to diagnose yourself. It is very important that you work with a healthcare provider such as an obstetrician, a gynecologist, or a midwife who knows your health history, so that when they create a plan of care, it addresses the needs that are specific to you. Now, as you can tell by this title, we are going to be talking about a topic that a lot of women deal with while they are pregnant, and that is heartburn. So without further ado, let us jump right in. So what exactly is pregnancy-induced heartburn? Well, when a woman becomes pregnant, she has a lot of hormones within her body that will cause certain tendons and muscles and just different parts of the body to relax so that the baby can grow comfortably. Well, one of those muscles that relaxes is located in a woman's esophagus. And when it relaxes, it causes stomach acid that is not supposed to come up from the stomach into the esophagus to begin to backflow up towards the throat. Since your esophagus is very sensitive to the feeling of acid, there's a burning sensation that accompanies it, and that is what is described as acid reflux or heartburn. Now, for some moms, heartburn will get worse as they advance along in their pregnancy, because think about it. The more your baby pushes up out of the pelvis into the abdominal cavity, the less space your stomach has to sit the way it's supposed to. So your stomach that's sitting nice and comfortable, when a baby is pushing up against it, it causes your stomach to move up closer to your throat, and that sphincter that is supposed to keep the acid from coming back up your throat is now positioned in a weird way where acid just shoots up freely and burns your throat. Now, acid reflux is not just something that can be described lightly. That burning sensation can feel like fire in the back of your throat, and it can really cause an individual to feel some strong pain in their chest muscles. A lot of moms who deal with acid reflux can also begin to notice some other symptoms in their body, such as a cough. So if you are pregnant and you're dealing with a cough that does not seem to get better or does not want to go away, talk to your healthcare provider about it, just to make sure that you're not dealing with acid reflux. Sometimes a woman will also deal with vomiting. And unfortunately, because vomiting is already a symptom that a lot of women deal with in pregnancy, they forget to get checked out to make sure that it's not just normal pregnancy nausea and vomiting, and that it could also be pregnancy-induced heartburn. So if you're dealing with vomiting and it is pretty bad, or it accompanies right after you eat a meal and you feel that burning sensation when you throw up, make sure you get checked out for pregnancy-associated heartburn. Now, there are some things that pregnant moms will do naturally that can also lead to them having a greater chance of suffering from pregnancy-induced heartburn, and that includes eating large meals. A lot of time, I know many women work and you don't have the freedom to break your meal down into smaller portions so that you can eat it over the course of a longer period during the day. So you eat when you can. Another thing that a lot of women do is after they eat, because pregnancy does consume a lot of energy, they immediately feel sleepy and they want to lay down. Now, some other things that can increase the risk of pregnancy-induced heartburn include high levels of stress while you are pregnant. You have got to find a way to manage your stress while you are pregnant. And then also, some women have cravings that are atypical. I remember one woman told me that she used to love going to a gas station and just standing there and breathing in the fumes. Strange cravings like spicy foods, food that contain a lot of onions, coffee, chocolate, things like that can also increase the likelihood that you are going to suffer with heartburn during pregnancy. So we're going to discuss some things that moms can do so that they can reduce or completely avoid, if possible, the chance of dealing with heartburn during their pregnancy. So what are some things that moms can do to help them avoid or decrease the chances of dealing with heartburn? Well, the first thing is make sure you are breaking your meals into smaller portions. As opposed to eating 3 large meals every day, break it up into 6 smaller portions so that you are eating more frequently during the day. What that does is, because large quantities of food just sit in your stomach for a long period and acid continues to churn around it, increasing the chances that it'll come through your mouth. When you eat smaller portion, your stomach processes it a lot faster and empties out the stomach chamber so that the chances of having acid because of large volume food come through your mouth is greatly reduced. Another thing you want to do is avoid known triggers. If stress is your trigger, you want to turn your stress levels down as much as possible. If you have multiple children and can get help with caring for those children, make sure you rely on as much external help as possible. If you have to work, make sure you are discussing with your boss so that stressful situations are minimized or eliminated so that your body does not deal with heartburn as a consequence of stress. Also, avoid some known triggers of heartburn. Known triggers include hot peppers. When I was pregnant, I was obsessed with habaneros. You could not make food spicy enough for me, and I paid for it in a very painful way. Now I have cut back seriously, and that heartburn is completely done away with. So one of the things that moms should do is avoid spicy foods. Make sure you are avoiding hot peppers. Make sure you don't have a lot of onions or anything of that sort in your food. Some other triggers include soft drinks that contain caffeine. Caffeine is a known irritant, so avoid it as much as possible. I mentioned chocolate being an irritant. I know moms like chocolate, and I know some people may come for me, but chocolate is one of those things that will cause your body to deal with reflux because chocolate, believe it or not, contains some enzymes that can interact with your stomach acid and cause that fiery churn up. Also, coffee. If you're someone who enjoys coffee, try to keep it at a minimal level, or if you can do away with it altogether, do away with it altogether. And every pregnant woman should know this, but you should not be drinking alcohol while you are pregnant. Avoid it in its entirety. Another thing moms can do is to avoid laying down right after eating. One of the worst things you can do is lay down on a full stomach. I know pregnant women love their sleep. I have been pregnant 4 times. I have delivered 4 healthy children. And as soon as food hits the stomach, the eyes begin to sway left and right and sleep begins to jump in. But after you eat, make sure you are trying to sit up for as many as 2 hours at a time. And this is because if you lay down too soon after eating a meal, that sphincter that's supposed to stay nice and closed like a flap, when you lay down, that flap becomes more loose, and then stomach acid can escape and come up your throat. So if you sit up after you eat a meal, you decrease the chances that that flap will be moving around and causing you discomfort. Now, I mentioned stress management just a few moments ago. Some of the things that moms can do to manage stress include getting a consistent amount of sleep every night. I recommend about 6 to 8 hours because I know that a pregnant belly is a very uncomfortable thing, especially if you want to change positions while you are sleeping. Use some pillows and prop yourself up in the bed. Number 2, to help you manage stress, try to sleep in a cool room. If you sleep in a hot room and you're sweating and you are clammy, you're going to be uncomfortable. You're going to wake up and then your body is going to be dealing with the stress of not getting enough sleep. Now, the trigger for heartburn can be as different as night and day for different women across the world. So the biggest takeaway from this video is know what causes you to feel that sense of burning coming up your throat. And once you are able to identify what your trigger is, then you will be better able to manage it. Now, if you have done everything that you can to manage the burning sensation that keeps coming up your throat and you are still dealing with it more than 2 times a week, it is now time for you to talk to your healthcare provider to see if you're not dealing with a more serious condition known as GERD or gastroesophageal reflux disease. Now, a little bit of acid reflux is not life-threatening, but it can make you miserable. So you definitely want to nip it in the bud or in the early phases as soon as possible. And by talking to your provider, he or she can make recommendations based on your presenting circumstances that help you manage or prevent the condition. Now, If you have learned something useful from the content of this video, be sure to give it a huge thumbs up and like the video. And then if you know somebody who deals with a lot of heartburn and can benefit from the content of this video, do share it with them. Also, make sure you hit the subscribe button if you have not done so already, so that you can join this growing community of active learners who are participating in their own healthcare and owning their own pregnancy journey. I wish you a safe, happy, and healthy pregnancy. And until the next video, be blessed.